everyone, and welcome to the Care Connection, SMC's podcast where we bring you top-tier care from people you trust. I'm your host, Chelsea, the marketing manager here at SMC. Each episode will dive into everything rural healthcare and more, the challenges, the wins, the people, and the stories that don't always make the headlines. This is your backstage pass to see SMC in a more unfiltered light, straight from the folks who live and breathe this work every day. I'm so glad you're joining us today. Our guest is Dr. Junaid Ebrahim, our internal medicine physician here at SMC, and we'll be talking about everything from what his daily life looks like to his favorite shows and what he likes to do for fun. So let's get into it. Well, thank you for joining me today to record the podcast, Dr. Ebrahim. Can you tell us a little bit about yourself and what kind of brought you to medicine and specifically internal medicine?
Sure. Yeah, I'm Dr. Junaid Ebrahim. I'm a board-certified internal medicine physician practicing here at SMC. Moved here from New York almost a year ago. Finished up my training in New York and now just enjoying the slow-paced small-town life. I enjoy watching sci-fi and supernatural shows. I do play a little bit of basketball and soccer. Currently following the FIFA World Cup. Spain is my favorite team. When it comes to internal medicine, per se, as a specialty, what really drew me to internal medicine is the ability to actually manage multiple complex issues while still being able to care for the person as a whole. There's a lot more about the specialty per se, but to put it, in simple terms, it is a specialty that focuses on organ systems and gives you a very flexible career.
Do you have any kind of patient story or moment early on where you had like something big happen and you're like, yep, this is the field I'm going into?
So, in a doctor's journey, everybody has those patients or events that they can never forget. And I've had several in my life, but I think one incident I would say is when I was in my third year of med school and we were just doing, in our regular clinical rotations, and a patient decompensated right in front of me. And the attending who was with me, the way he diagnosed what was going on with him, because he had like all these multiple complex issues, and pretty quickly escalated care and managed him in front of me. He was having something that we call pulmonary edema from his high blood pressure and chronic kidney disease. The way he diagnosed, the way he treated and brought him back to life was something that really put a huge impact on me, and decided why I wanted to go into the specialty. Again, like I said earlier, not focusing on just one area and being able to manage multiple systems at the same time is what makes this specialty really beautiful.
That's awesome. That's a really cool thing. I can imagine now. I'm sure you've heard of it, but everybody like watches The Pit and everybody, the ER room and everything. And it is cool to see, to think people actually have those moments that you see on screen of somebody is literally losing their life on the table and you step in and you save them. So that's got to be an incredible feeling.
Yes, absolutely. And that's kind of like what I do when I'm doing my inpatient side of internal medicine, because I do clinic, but I also do a little bit of inpatient medicine too. And those are like really sick patients.
Yeah, that's awesome. And now, correct me if I'm wrong, but I think, aren't you going to start going out to our outreach clinics as well?
Yes.
A few times a week?
Yes. So I did start going to Tabor Clinic.
Awesome.
So we're trying to build a patient panel at the Tabor Clinic as of now. So I guess the plan is to start going there once a month, and then depending on how the patient flow is, we might increase the number of days I go.
Nice. That would be a really great asset for that outreach in that community. Mm-hmm. That'd be really awesome. Walk us through like a typical day of what that looks like for you, and the variety and what kind of visits you manage, what chronic conditions you see most.
Sure. So my typical day here at SMC would mostly be in the clinic, and some days, like I said, I would be on the inpatient floor where I would admit patients from the ER and take care of them during their hospital stay, but mostly in the clinic. One of the best things about what I do is the variety, right? So in a day, in one given day, I would be helping a patient prevent a disease, followed by managing a patient's challenging chronic condition, followed by treating a patient's acute illness, and and another patient I would be doing a procedure such as paracentesis, all in one day. And that truly is what makes this specialty, again, beautiful, is the variety. In one single day, I could be doing all of these different things. But otherwise, mine, if I'm in the clinic, it's typically 8 to 5 job. I'm here 4 days a week. If I were to talk about the kind of diseases I manage, my typical patient would be someone who has diabetes, heart disease, COPD, or asthma. They also have gout, and they get treatment for all of these conditions under one roof instead of having to see 5 different doctors who manage these.
They
They just get me, and
That's
I manage
awesome.
all of them together because mine is a system-based approach.
Awesome. So in our specific area, is there something that you see more often than other things? Like a combination of like diabetes and heart disease?
So our town, because we have a lot of older population, we do see a lot of these old, age-related diseases, which is, your diabetes, your heart disease, your COPD, your cholesterol. Yes, those are the kind of conditions that I do see a lot in our community, as opposed to maybe like where I practiced before in New York, where, we had a mix of younger people, equal amount of younger people, and we would have a lot of tick-borne diseases. Whereas here in Southwest Iowa, I haven't really seen any tick-borne diseases. It's mostly the lifestyle diseases that I see.
Okay, that makes sense. Do you have any way that when you're managing this, you work really hard at like building that different kind of relationship with patients? It's a little bit different than what you had in New York.
Oh yeah, absolutely. So in New York, building relationships weren't really a big thing, to be honest, because everything is fast paced.
Mm-hmm.
New York life is fast paced, right? Even your heart's beating fast. Whereas here in Southwest Iowa, I feel like, yes, definitely, I do feel like patients become family. I feel like some days or most days, I don't feel like I'm actually doing a heavy job. Just feel like I'm taking care of my family members and neighbors because I see these people outside the hospital all the time.
You work with them.
I work with
go
them.
to the hospital or go to the grocery store.
I see them. So it's really, you're just taking care of your neighbors. So it's very easy to build that relationship with them. And also, I strongly believe building that relationship or that trust factor doesn't happen in one or two visits, right? It is the small steps and the consistency and, being honest to them, even when I don't have the right answers all the time. Mm-hmm. That really builds that relationship with them.
That's really nice that you can have that feeling and know that there's just such a difference between working in a large population hospital like in New York versus somewhere in a more small community like here.
Yeah, absolutely. That is very true.
We kind of talked about this a little bit, but we just talked about what makes practicing medicine here a little bit different than other places. Do you have like a reason or, of why you chose a smaller town versus where you were before?
Yeah, so I would say both personal and professional reasons. So personal reasons being when I started my training in New York, I was single at the time. Mm-hmm. And then I met my wife, and then we had our kid who's 2 years old now. So by the time I finished up my training and my chief year, we wanted to kind of move to a smaller town with, a lot of neighbors and safer neighborhood. Mm-hmm. Also enjoy that slow-paced life, less traffic, etc. And that's how, as I was interviewing at multiple places, I came to Shenandoah, really liked the hospital, and we chose this is the place we want to be. This is where we want our daughter to grow up.
That's awesome.
Professionally, yes. Like I said earlier, it's easier to build relationships with patients. People. It's but you also want to help these smaller communities that don't have access to all these specialties. Because, for example, in my specialty, internal medicine, I'm the only doctor in this hospital. So there is a real need for our specialty. So in a way, you're also doing a service.
Right. I can kind of relate to that, obviously, not a physician, but I came from Colorado. And so it was a much larger city, with tons of hustle and bustle. You're always going. And just moving here, it's life almost goes slower, if that makes sense. Like you can actually like breathe and enjoy a sunset, and you don't have to be go all of the time. Things are very fast paced. It still goes very fast, but it does feel like you can breathe a little bit easier in a small town, and you have that more kind of a safety net almost, if you will, of, you can have a soft landing, and, your night can just be relaxing.
Exactly.
And,
you can, my drive back home is the best.
Yeah.
After work. Whereas when I was in a big city, all I would hear is, horns and people yelling.
Yeah, noise. Yeah.
It's so noisy. Yes, exactly. That's the word, noise. It's not noisy here.
Right. No, I totally agree. Yeah, definitely. You would have to do a lot to get me to move out of the small town now. After being a city girl and now being a small town girl, definitely love small town.
And the other thing is, we also have access to a big city.
Exactly.
Right? That's again one of the reasons why I chose Shenandoah, like a big city, like an airport, and living in a small town also has its cons, right? You have certain things that you don't get in big cities.
Right.
So, but having that big city close to you is definitely a plus.
I know, it's an hour drive, and you have all the amenities that you normally would.
Exactly.
So I totally agree with you. Worth it to me. Your wife is also a physician, correct?
Yes, she is. So my wife is a physician, and I have, like I said, a 2-year-old daughter. She is planning on doing her pediatric residency training,
Awesome.
which we had to put on hold for a while because at the time of her pregnancy was a little complicated. So she's still finishing up her studies, and then hopefully she'll get into a pediatric training program soon.
That's awesome. That's awesome. I'm very excited for that. We need more pediatric people around here, so that makes me happy. Let's get in, since it is still June, let's get into Men's Health Month.
Mm-hmm.
Do you see anything as far as like when you're treating men? Is there a certain message that you want to pass on to them? Like just talking openly about, their health. And it just seems like men are far less likely to talk about like, oh, I need to go get the screening, I need to go do this for my health, than women are.
Mm-hmm.
Do you see that? Do you have, from your perspective, what conversations do you wish more men in Southwest Iowa were having?
So yes, 100%. I do see it in men. One message that I do want to pass to all the men out there: being tough does not mean not taking care of your health, right? You can be tough, and you can also be proactive and take care of your health, right? It is not a sign of weakness asking or, seeking help, right?
Right.
Because what I want men to understand is not all men. I don't get me wrong. I do absolutely have men who are very proactive, but for the ones who do think that seeking help or getting care is a sign of weakness, that is not true, because small steps that you take today can, help build a strong future. The other thing I want men to understand is physical health and mental health are closely linked. And we do have decades worth of studies showing us that conditions like diabetes, cholesterol, hyperlipidemia, diabetes, chronic pain conditions, insomnia, they often coexist with conditions like anxiety, depression, mood disorders. So, establish care with a doctor, talk about your concerns, talk about your the preventative screenings that are necessary for your age, and get the ball rolling, because when diseases hit you, they hit you hard.
Yeah. What diseases do you see most in the men around this area that you treat?
Mostly it is high blood pressure, diabetes, heart disease, high cholesterol. And because we do have a fair amount of men, or both men and women, who smoke, I do see a lot of COPD patients as well.
Okay.
And smoking in turn also affects your blood pressure. It does.
Right.
It causes multi-system issue. So if there's one thing I would, send out as an advice or a habit to get rid of, it would be to get rid of smoking.
Get rid of smoking.
Yes.
All right. I feel like that should be a known thing, but yes, I would agree with you. Are there any screenings that, like, if somebody, say they haven't been to the doctor in 15 years, are there certain screenings that you think that they should do first? Like, what would be your top 4 screenings for men to get?
So it depends on your age.
Okay.
Right? So let's For example, let's say a middle-aged man who is 45 or 50, or let's say 50, right? And also the other thing that we look for are these habits or these risk factors, right? So for example, we have a 50-year-old male who also does smoke, right? At that age, they definitely would need something called, I say, low-dose CT chest, which looks for lung cancer, all right? And at the age of 50, which is actually, you start at the age of 45, you need your colonoscopy, right? Colon cancer screening is extremely important. Now, colonoscopy is the best test, but we do have other tests like stool-based blood test for people who are not interested in doing a colonoscopy, because everybody has that fear of doing colonoscopy because of the prep and everything. But it is just once every 10 years if it's a colonoscopy, and you're covered. And then the other thing would be for somebody who is 50 would be vaccines. So your pneumonia vaccine starts at the age of 50, your shingles vaccine starts at the age of 50, your tetanus shot, if you're not up to date with that, every 10 years, and obviously your influenza, depending on the season, and then your COVID vaccines. But yeah, these are some of the most important things. And then your diabetes screen, obviously, and then checking for cholesterol. Now, the cholesterol guidelines have also changed, so we have more testing to do now. We have something called as the LPA screening, which is like a universal screen for every adult now, which tells us if somebody is at high risk of heart disease in the future. So yeah, cholesterol, your diabetes check, blood pressure screening, checking for lung cancer, checking for colon cancer, and then every adult above the age of 18 once in their life should have the HIV and hepatitis C screening done. So those are your infectious screenings, because the reason is because they don't produce a lot of symptoms. You may not know that you have it until, you're many years down the disease.
Right.
So that's why those are also important screening.
Right.
There's a lot more, but, in a nutshell, that would be, would be something that,
it's something that I feel like people should know. And it might be, again, one of those things that, I feel good. I don't need to go to the doctor.
Exactly.
And you might be missing something little along the way.
And what's most important is what people need to understand is, for example, like these CT lung and the colonoscopy, these cancer screenings. I've recently seen some patients tell me like they don't want to do their mammogram or colonoscopy because they fear something will be found. That's the whole point, right?
Right.
We want to catch it early, because when it's caught early, we can actually treat it. Right? You can go into a full remission. But when it's advanced stage, it's spread to other parts of your body, your life expectancy drops and your chances of actual remission drops, and the treatment gets more and more complicated.
So when you have those patients that come in and, they haven't had a screen in a long time, and they're like, I just, I don't have a time in my life right now where I could find something. And, I say I do end up finding a spot of lung cancer or something. I'm really scared about, trying to go through that and start that whole process. I have a lot going on in my life. What would you say to them as a patient?
So what I usually, one of my selling points that I use is, if, like, for example, some men that I know, they're more focused on their job, building wealth, taking care of their families. They think that's what, and providing for their families. And yes, it's true, men do provide for their families, and that is a thing, but women do too. And one of my selling points is that if you have a disease and that's not identified and it becomes a major illness, without health, you won't be able to do any of these things. Right? I tell them you can be bankrupt, you can lose everything you have, but if you have good health, you can still start from nothing and build your way up, right? Or you can still function. But if you don't have health, no matter what you have, it's not going to be useful. Right. This is one of the selling points I use for some of the patients.
Yeah, you want to be able to take care of everything if you're not here.
Yeah, you can have everything in the world, but if you don't have the health to enjoy it, then what's the point? Right. So
that makes sense. That makes sense. Do you have any special message that you'd like to give, since we're still talking technically Men's Health Month, but anybody could take this message regarding mental health? Because I know in Iowa, our mental health isn't always the best. We don't have a ton of facilities. We don't have a ton of people. We do great at SMC here. We have a whole behavioral health team, but it's hard to find behavioral health in the state of Iowa. Do you have any kind of message for people out there that are looking, that can use any kind of advice about exploring their mental health and trying to get help?
Yeah, absolutely. So one of the most important things is to actually know or identify you actually have a mental health issue, right?
Mm-hmm.
A lot of patients, they get dismissed or they dismiss their own symptoms when their body or their mind is actually telling them that they have these symptoms, right? So it is important not to self-diagnose and actually reach out to a board certified behavioral health or like a primary provider and talk through your symptoms and let them make that decision, because we have a lot of patients who go easily undiagnosed for years and they suffer for no reason just because they did not talk to a healthcare provider. So that would be my one advice to all the people out there.
Yeah. I think too, it's easy for us because I think we're in it every day, and we we hear it and we're like, oh yeah, you have to just be open and it's okay, nobody's going to judge you. But I think especially being in a small town, there's this stigma about mental health, like, oh, if you go get therapy, something's wrong with you or something like that. So I feel like people getting the understanding that like this is normal, like everybody can see a therapist. It's a normal thing. There's no judgment around it. Like if you come to SMC to see a behavioral health person or talk to your primary care provider about it, like nobody's going to judge you. Nobody, there's none of that going on. We want you to get help. We want you to be seen. We want you to be healthy. We don't want you to be suffering, like you said.
Exactly. And yeah, the stigma exists for not just mental health, but for a lot of conditions. People think getting a certain infection like, hepatitis C or HIV, for years we've dealt with the social stigma of having those illnesses. Same thing with mental health. And like you said, in small towns, because the words get around real quick, people do fear that. But like I said earlier, without taking care of yourself, you won't be able to be productive. So please do establish that visit, because like you said, we have a great behavioral health team at the hospital. So
it's one thing, I don't know if you knew about it, but we had a Parkinson's walk here at the Wellness Center on Saturday. And one of the speakers was a woman with Parkinson's, and she has a group called This is Parkinson's. And when she was giving her speech, she talked about how even something like Parkinson's, like why would you think anybody would be ashamed? Like you didn't choose that, like it just happened to you. But she was talking about how she was so ashamed that she had Parkinson's, and like she didn't want to tell anybody. She didn't want to, she didn't want her family or friends to know. Like she got the diagnosis and then she just put it in a box and put it away because she didn't want to deal with it. And then she kept realizing as time went on, like it's getting worse, and it wasn't necessarily something she could hide anymore. And she was very adamant, like tell people what you have, like tell your provider how you're feeling, tell somebody so they know what's going on with you, so that they can be there to help. They can be there, kind of as an advocate for you. And it's just interesting, we talk about mental health always having a stigma, but you're right. There's other things. If you get, HIV or something, there's such a stigma behind it. But, most of us are just here to help you.
Exactly. Yeah. It like you said, sometimes, we think too much. We think everybody's talking about us, or everybody's, thinking about us. That's not true. Everybody just wants to help you. Everybody just wants the best for you, at least people in the hospital. So I totally agree with what you said. Yeah.
Well, we kind of touched on everything that I wanted to talk about. We kind of jumped around a little bit, but is there any other message or anything that you want the community around here to know about Dr. Ebrahim?
I think we spoke about most of the things, but like I said, if anyone has chronic complex medical conditions and they think they need an internal medicine doctor, we do have that service here at SMC. I'm the internal medicine doc here. Please do schedule an appointment, and I am accepting patients.
Awesome. And if somebody was like, oh, they listen to this, you're like, you know what, I want to go be seen. When they call to make that appointment and they come in with you, what does that first visit look like?
So the first visit is definitely going to be a little long. So I usually, when I walk in, I tell my patients that this visit's going to be a little long, because at that visit, I'm trying to understand your medical history, and also getting to know the patient. Like when I start off that first visit, I would like to know everything about the patient as much as they're willing to disclose, right? I want to know what they did for work or what they do for work, what their habits are, if they have any mental health or other medical conditions, go through their medication list. And then once I have all the data, then we kind of create formulate a treatment plan, and then we have our immediate things that needs to be addressed, and then we also formulate a plan for the future, what we're going to do and what we're aiming to achieve, and try to kind of consolidate everything and treat all their problems. And if at all they need some specialist involvement based on our discussion, get them on board with a specialist as well.
So easy peasy.
So it would, when you say it, it sounds easy, but once you actually start dealing with each of their medical problems, you understand how they're treated, if they're undertreated, if their medications and things like that. But like I said, it might be a little long, but that visit is extremely important because that tells us what we need to do for the future visits.
Gotcha. Well, if anybody is wanting to see Dr. Ebrahim, you can call and make an appointment. You can go online and make an appointment. If you're in an outreach clinic, he'll be in Tabor once a month. Is there any other something that you want to say to the audience? Any other, even if it's not work related?
I'm a huge soccer fan now, and please do support Spain.
Okay, support Spain, everyone, please. When do they play next?
Friday.
Friday.
Yes.
Okay, so you will be watching.
Yes.
Awesome.
They just won Saturday 4-0 against Saudi Arabia.
Nice.
Yeah, the game was mind blowing. It was amazing.
No, I know you were a basketball player, correct?
Yes, I do play basketball as well.
Did you ever play soccer?
I do play soccer as well. Yeah, nice. Not a lot, but here and there. I mostly watch or follow soccer than playing.
Gotcha.
Because I'm not really that good at it.
I'm not good at any sports, so I get you. That's all right.
I just play because by playing, I'm actually moving my body. But when I go to the gym, if I'm alone, I may not do a lot. But when I'm playing, you just kind of get carried away, and then you also move your body.
Sorry, derailing the question for a second. There's a ton of people that are like, oh, you need 10,000 steps a day, or oh, you need 15,000 steps a day, or oh, you need 20,000 steps a day, or you don't even need steps a day, just do this. What is your opinion on the amount of steps a day somebody should have? So
I'm not very heavy on the steps per se, but what I would recommend is every adult needs at least 30 minutes a day for at least 5 days a week, a workout session. It could be, and that needs to be a mix of your cardio along with your strength training. A lot of people get the idea wrong that only cardio is important. So that's where your steps come into play, right? So steps alone is not enough. You also need to do a little bit of strength training, especially if you're a female postmenopausal. Because once you lose the estrogen support, then your bones start getting weaker and weaker. So in order to prevent osteoporosis, the best way is not cardio. It is, we know from studies that strength training is actually what helps prevent that bone density.
Good to know. Just I always try to ask because I'm like, you hear so many things, with social media, what it is now. There's all of these like workout people that, influencers and whatnot, always saying, oh, you need this. So it's kind of nice.
I always tell my patients, keep it simple, but do it every day.
Keep it simple, but do it every day.
That's what I would tell my patients. I don't expect my patients to do deadlifting every day.
Right.
Even if it's like a 30-minute treadmill walk or like a 30-minute run, more than enough.
Just do it.
Just do it. That's consistency is more important.
Not work related. What did you? There's spoiler alert. Now that's we'll do. What did you think of the final episode of Stranger Things?
Oh, okay, yeah. I felt it was. So it had like really some of the peak moments where like they blew up the chopper and everything, but I didn't really quite like the ending where like everybody thought. I forget her name. Elle died, and then now she's somewhere else. I didn't really that really didn't work for me. I wanted it to have like a happy ending where Elle would stay with the rest of the gang, and they would all go to school together or college together or whatever.
Yeah.
But otherwise, yeah, I mean, everything else seemed really nice. And then also the part where, all these kids were fighting the, again, I forget what it's called again.
The giant Demogorgon thing.
Demogorgon thing, right?
I did have a name.
Vecna, yes. Not Vecna. Right?
Not Vecna, but the thing that he was in.
Yes.
I don't remember what they ended up.
It's been months, so I
know it's been a minute.
Yeah, I'm forgetting all the characters, but anyway, Vecna, or the big Demogorgon. The fact that all these little kids were fighting the big Demogorgon alone, and then the military
couldn't do it. I also had a problem with
couldn't do anything about it. So I'm like, okay, we have high school kids fighting a Demogorgon. So that part, didn't work for me. But sometimes you just have to ignore those things and watch it as a show. And that way, I did enjoy it.
Okay, that makes sense. Yeah, there was a few times where it was like, there was one part, this probably wasn't the finale, but when like Vecna came through finally, when we finally see him after we know that he's actually in there somewhere, and he just like destroys the army, but he doesn't actually kill any of our cast members. I'm like, he was like putting his hand through people's faces, but like didn't touch any of them. That part I was like, is that believable? Or, so I get what you mean. But
my only thing with the Duffer Brothers were like, please don't do anything to Dustin or Steve.
Agreed.
You cannot touch them.
I
was telling my wife about this. Please don't touch, Steve or Dustin.
Yes.
I just wish they don't touch them.
Right. Yes. I was really sad when Eddie died in season 4, because Eddie Munson, the rock and roll guy, he was my favorite. I loved him, and I was so heartbroken when he died. I was like, they have to bring him back. They have to. I can't.
Yeah.
I was so sad. So I was on your same boat. I was like, do not kill Steve and do not kill Dustin. You can kill anybody else, but those two must live.
Yeah. Yeah. And Steve was actually about to in the last episode, and then the other guy pulled him up. I forget his name.
Oh my gosh, I always forget his name too.
Yeah,
Will's older brother.
Will's older brother.
Jonathan.
Jonathan, yes.
Yes,
Jonathan saved him.
No, I thought Jonathan would die because there was like that weird moment where it was like Steve was definitely still in love with Nancy.
I was expecting somebody to die. But
none of our main characters really. I mean, Elle died.
Yeah,
I think. I don't know.
Yeah, because there was a thing like, that in the end it would just be like the other kid would be just writing a story, and everything was just like
I heard
like
that.
a story.
Yeah, like it was just a story.
Lot of speculations. But yeah.
Yeah, it was good. Have you seen the Duffer Brothers' other project that they just did, the Burrows?
I didn't see the Burrows, but there was another one that they co-produced. It's a something very bad is going to happen.
Yes,
something very bad is going to happen. I don't like it.
Oh no,
I don't like it. It's not the Duffer Brothers level.
I didn't watch that one, but I just watched the Burrows, and that's another one that the Duffer Brothers did. I liked it a lot. It was really, it's definitely in the same tune or font of Stranger Things. Like it's that same kind of sci-fi supernatural vein.
Okay.
But it's really cool. It's almost like, I don't want to say time travel, but it's got a lot to do with like time, and it's really, really cool. I enjoyed it.
Oh, nice. I'll definitely watch that, because I'm currently watching a K-drama, actually. It's called Teach You a Lesson.
Okay. Oh, is it on Netflix?
Yeah.
Okay. I think I've seen thing like things come through.
It's in the top 10 shows now.
Okay.
It's a K-drama. So it's like some a guy who comes in. I just watched like one episode yesterday. Mm-hmm. So it's like a guy who comes into school to kind of teach these high school bullies.
A lesson.
Teaching them a lesson. Yes.
Nice.
So I just watched one episode, but it's like top 10 list. So we'll see how it goes.
Nice. Now we talked about The Pit earlier. Have you seen The Pit?
Yes.
Yes. in your personal opinion, and your professional opinion, is that pretty accurate to what it feels like in an ER setting? Have you been in an ER setting?
Oh yeah, absolutely. So like as an internal medicine doc, part of what I do if I'm doing inpatient is admitting patients from the ER. So once ER and internal medicine docs are, majority of the hospitalist physicians, right? And there's like a small percentage of family medicine doctors who also go into hospitalist medicine, but mostly family medicine goes into outpatient and internal medicine goes into hospitalist, or both clinic and hospitalist. Okay. So when doing inpatient, I spend a lot of time in the ER. And during my training as well, because I have to do, we had to do ICU, medical step-down unit, inpatient. We spend a lot of time in the ER. And the PIT, because it is in a big city like Pittsburgh, and New York City is also similar to that. It is exactly what they're showing. The chaos, everything that you see is exactly the same. That's now medically, a few things here and there. Yeah, we might have difference in opinion because it's a show. May not everything might be accurate, but they did do a pretty good job compared to a lot of other medical shows. Yeah, that's what I've heard. But all the chaos that you see, people fighting, the heated environment, it is, that's what it is. Yeah, that's exactly what it is. You would not see that here in Shenandoah, but that's how it is in a big city.
Oh, good to know. Good to know. So bless those ER workers.
100%.
Yes. Awesome. Well, if you have any other messages for community,
I think we're good.
Awesome. Thank you for giving me an hour of your time and doing this interview with me. I'm sure people are going to be super excited to hear from you. And I'm sure there'll be more in the future, but I really appreciate you taking time out of your day to do this.
Yeah, absolutely. Thank you so much.
Big thank you to Dr. Junaid Ebrahim for sharing his perspective on primary care and internal medicine in rural Iowa. That wraps up this episode of The Care Connection, a little behind-the-scenes look at SMC. If you learned something new, share this episode with a friend or a neighbor. Thank you so much for listening and being part of the Shenandoah Medical Center community. You can follow us on all the social media platforms to keep up with the latest news, what we have going on, and different wellness resources available. We will see you next episode. Thanks again for listening. If you're interested in getting involved, you can sponsor an episode of The Care Connection, and all proceeds go to fund the SMC Foundation's car seat program. For more information, you can contact me, Chelsea, at 712-246-7074, or feel free to email me anytime at cjuarez@smchospital.com.